Okay, folks, so we are plugging right along, moving into injuries and disorders of the nervous system. So, skeletal and muscular disorders. Skeletal disorders do not really have anything to do with the nervous system, but muscular disorders for sure do. So, a lot of the ones that we looked at when we looked at muscular disorders are also part of nervous system disorders, or they have their origin in the nervous system as well. But the ones we're going to look at in this are unique to the nervous system, injuries, and disorders. So, if I can get it to go. So, we're going to start with injuries to the brain and the spinal cord. The three we're going to look at are traumatic brain injury, cerebral palsy, and spinal cord injury. All right, so traumatic brain injury, this is sort of not a new disorder, but it's gotten a lot of attention, and we're definitely having to treat it more in the last 20 years because of the wars in Iraq and Afghanistan have caused a lot of soldiers to come back with traumatic brain injury. So what traumatic brain injury is a violent impact to the head, particularly when the skull is pierced or fractured. So a lot of the dirty bombs, I guess, that have been used in terrorist attacks, definitely they are meant to cause as much trauma as possible, and especially really death. But we have been able to save lives with the help of modern medicine, but we really can't fix the injury that is happening to the brain, not completely. So these are classified in three different areas: mild, moderate, or severe. Someone could be classified with a mild traumatic brain injury or TBI and just have some personality changes or things like that. Moderate could be, maybe they've lost the ability to walk or don't have as much coordination, and then severe would be, they're just completely incapacitated. So those would be the three levels there. All right, cerebral palsy, this is, we definitely have more of this and have for years. This is a disturbance of voluntary muscle action. So remember, your voluntary muscles, those are your skeletal muscles. So there's the involuntary muscles are not affected, like the breathing or anything like that. But the voluntary muscles are, so arms and legs, the large muscle groups. This is caused by brain damage, most of the time by lack of oxygen to the brain. This can happen at birth or before birth. It can happen in the womb where the baby was deprived of oxygen, or maybe sometime during birth the infant was deprived of oxygen. Could also happen from prenatal rubella, or this is the German measles, the MMR vaccine, measles, mumps, and rubella. So rubella is the R portion of that. It's super important that pregnant women are immune to that, because just being exposed to it can cause cerebral palsy of the infant. And then certain infections that a mom has could then pass on to the infant or in the womb. All right, so what are the symptoms of cerebral palsy? They have very overactive reflexes, and they also have seizures. So their reflexes, if you remember when we checked reflexes, they just have extremely hyperactive reflexes. Their muscles are very, very tense. They are basically, the area that's being affected is constantly tense, or constantly in a spasm, a muscle spasm. So it just depends on the level of cerebral palsy, the level of the brain that was damaged. This could just be one leg, one, part of a leg. It could be the arms. It could be all over. It really just depends. They also have contractures. Now, contractures is where the joints freeze into a particular place. So from those muscles being so tense, they are not able to stretch those muscles out, and those joints get fixed. And so they'll have severe contractures. Sometimes they'll have speech impairment, spasms. They could have possible mental retardation, or the new word for that is intellectual impairment. They could have that. Now, some people with cerebral palsy have a complete and total, mentally they are totally fine. It's just physically, but sometimes they're not able to communicate. So there is no cure for this. The way that we treat it is with physical, occupational, and speech therapy. Muscle relaxants, anticonvulsive drugs in severe cases where they have seizures. They also have casts or braces to try to, to where they can have as much movement as possible. Sometimes really severe CP will have to have orthopedic surgeries for these severe contractures. And then we also have computers that speak for the patient so that they're able to communicate if they're not able to communicate. All right, so this video is about that. I'm going to post this video and also post a question about it. This will be to make sure you watch this because this will be part of the video takeaways, which will be another assignment. Okay, moving on to spinal cord injuries. So we didn't spend a ton of time in your anatomy courses. You will talk more about the spinal cord and the individual, nerves, C1 through C8, and that's the cervical division, which on here is the red portion. Then T1 through T12, that's the thoracic nerves, and over here tells you what they do. Then L1 through L5 is the lumbar, and S1 through S5 are the sacral, and what each one of those do. Okay, if there is an injury in C1 to C3, so you can see here C1, 2, and 3, breathing and head and neck movement. So if something happens here, most of the time it's going to be fatal, okay? C4, heart rate and shoulder movement, but most of the time C1 through C3, if there is a spinal cord injury there, that's going to be a fatal injury. C1 through C4, okay, let's say that they don't die from that injury, then they will most likely be a quadriplegia, meaning that they will be paralyzed from the neck down, so paralysis of all 4 extremities. C5 through C7, so if it's in this area, they could have paralysis of the lower extremities or paraplegia. And then anything that happens T1 through L5 leads to, they will probably or could be paraplegic or have paralysis of the lower extremities. Okay, so here are just those definitions. Paraplegia is paralysis in the lower extremities or lower parts of the body. So that would be the legs. Quadriplegia, this is all over paralysis of the arms, legs, and body. And then hemiplegia, this one is going to be so important here in just a minute when we talk about stroke, this is paralysis of one side of the body. This is caused by a tumor or an injury or a cardiovascular accident or a stroke, okay? Commit these to memory because year after year after year, students miss these, okay? So quad means 4, all right? So you can go ahead and know, okay, this one's all 4. Para means 2, okay? Hema means one-sided. So just memorize those, okay? They will be on the test. All right, there is no cure for spinal cord injuries. Our care is supportive physical and occupational therapy. And then research is directed toward repairing the spinal cord damage. Now, sometimes a doctor can say they'll never walk again, and they do end up walking. The brain and the spinal cord, we don't understand as well as we would like for sure. But the research is directed toward hopefully one day being able to repair this damage. Here is a really exciting video. You will love this video, so take a moment to watch this when we finish the notes, and there'll be some questions about video takeaways, okay? All right, here's another one about spinal cord injuries. Okay, cerebrovascular accident or stroke. This is when the blood flow to the brain is obstructed, and this can be by various causes. But whatever the cause, which we'll talk about some of the causes in a minute, the blood flow is obstructed. And so that means oxygen is not getting to the brain tissue. So the lack of oxygen leads to destruction of the brain tissue. Remember when we were doing CPR, we talked about how, we're trying to save brain tissue. We are trying to save the brain. That's what we're trying to do with CPR. So in a stroke, basically, you are on a clock of trying to save this brain tissue. There are a couple of different causes. The first one is cerebral hemorrhage. And this results from the main cause is hypertension or high blood pressure. So when we did our lifestyle diseases, that's why hypertension is such a biggie. Because that is the biggest cause of stroke is hypertension. So this is just where a blood vessel bursts in the brain. Another cause for cerebral hemorrhage would be aneurysm, where blood pressure is not involved. There's just a weak blood vessel in the brain. This can really happen at any age, the aneurysm one. Now the hypertension, that would usually be from years of lifestyle issues like, poor diet, no exercise, those kind of things. All right, the second cause is an occlusion or a blockage. So in the top one, they're bleeding out, like they are bleeding, and so a blood vessel has burst, either from hypertension or it was a weak vessel in the first place. And so they're bleeding out into the skull, and so the blood flow is not going where it needs to be. And the second cause is an occlusion or a blockage, and this is caused by arteriosclerosis or hardening of the arteries or a blood clot. Okay, so yet again, this is normally from people that have high cholesterol are at a big risk for this, where they just get fatty deposits built up on their blood vessels. And so that can definitely cause an occlusion or a blockage. So the symptoms are the same regardless of what the cause is, okay? Regardless of what the cause or what type of stroke it is, it's going to present the same, okay? So loss of consciousness, weakness, one-sided weakness for sure, vertigo or dizziness, hemiplegia, paralysis on one side of the body. And this is normally very sudden. Like they might be fine one minute and another minute they're very dizzy, and maybe they have facial drooping. They're having that paralysis on one side of the body. That's an emergency that you call 911. Dysphagia or difficulty swallowing. They may not be able to swallow. They may start to have visual disturbances. Think brain. Anything that has to do with the brain, they can start having issues with. Confusion, for sure. Not realizing where they are, what's going on. Aphasia. This is speech or language impairment. Either they won't be able to talk, or they'll be talking and saying the wrong word, but they think they're saying the correct word, like instead of turn on the lamp, turn on the shoe. And they can't understand why we can't understand what they're trying to say. That's true aphasia, and definitely a sign of something neurological going on that could be a stroke. Also sudden incontinence, like loss of bowel or bladder control. All right, so what is our treatment? First of all, the immediate care in the first 3 hours can help prevent brain damage. Okay, this is why I say if you see any of those symptoms in your loved one, or if after you get out of school, if you see some of those symptoms, if you suspect a stroke, you call a code stroke, because those first 3 hours can really help prevent brain damage. If it is a blood clot, then we do have these thrombolytic drugs called clot-busting drugs that help save brain tissue. This was really revolutionary several years ago when these came out, and saved thousands of lives and made quality of life after a stroke better. Obviously, a clot-busting drug cannot be used in a hemorrhagic stroke, because if they're bleeding out, you don't want to give them blood thinners, okay? But if it is, and this is a stroke is easy to diagnose. It's a CAT scan, and when you hospitals that are considered stroke centers, they have passed the qualifications to be called that, in that they can have a stroke diagnosed in 20 minutes. And that's, from the time the person hits the door, they get them straight back to a CT scan to see what's going on. There are neuroprotective drugs also that help prevent injury to the neurons and try to prevent permanent brain damage. So, but yet again, you are really racing against the clock here. All right, so you can watch this little video also when it'll be posted. All right, so common diseases and disorders of the central nervous system. We're going to look at meningitis, multiple sclerosis, epilepsy, Parkinson's disease, and then dementia and Alzheimer's we won't have notes about. There will be another assignment posted for a article review on that with some questions. Okay, so meningitis is inflammation of the meninges of the brain and the spinal cord. So these are the meninges is the tissue that surrounds the brain. Okay, so obviously this appears post-mortem to me, probably from an autopsy, but inflammation in the meninges or the brain is going to be meningitis. It can be caused by bacteria or it can be caused by a virus. In honesty, you want it to be caused by bacteria because we can treat bacteria or bacterial infections with antibiotics. Viral infections, not so much. So if you have to have meningitis, bacteria is a better form to have. All right, so the symptoms are a very high fever, headache, back, neck pain, and stiffness. Patients that have meningitis will not be able to put their chin down to their chest without severe pain. So I know you're all doing it right now to see if you can put your chin down to your chest. They would just have so much stiffness and it would be so painful to put their chin down to their chest. That's a big sign that they could have meningitis. Nausea and vomiting. And this is progressive. It usually starts with, they'll spike a fever, they'll have a really bad headache, they'll have this back and neck pain, this stiffness, then it moves to nausea and vomiting, then we're going to go into delirium and convulsions, and then coma and death if not treated. Okay, so this is yet again an emergency as well. So how do we treat this? We treat it with antibiotics, anticonvulsants, medications for the pain, and cerebral edema. If it's viral, then we're just giving supportive treatments like fluids and trying to protect them from other infections and things like that, and the anticonvulsants and convulsants, and trying to get that edema and swelling to go down. All right, multiple sclerosis, or MS, you may have heard this before. This is a chronic, progressive, disabling condition that results from degeneration of the myelin sheath in the central nervous system. The video that goes along with this is going to show you, a little bit. If you don't know what myelin sheath is, if you haven't taken anatomy yet, it's like the insulator around our neurons. And it's really what allows the messages in our neurons to go from each nerve cell to the next nerve cell. And so if this myelin sheath, if it degenerates, then the message is not being communicated. This really, unfortunately, usually occurs between the ages of 20 and 40. And the cause is just completely unknown. There could be, maybe, some genetic factors, but at this point, the cause is unknown. So the early symptoms that a patient will have is they'll start having some visual disturbances. But, how many times do you kind of see visual, maybe see stars or whatever, and you just kind of blink your eyes a few times, and then, it goes away. So you could very easily, someone who is experiencing multiple sclerosis could very easily pass off these symptoms. They'll start having some weakness and fatigue, just tired, and maybe even poor coordination, or they just start becoming clumsy. So, yet again, this is not this is not a child. Normally, this is usually an adult that's 20 to 40. They may also have some tingling and numbness in their extremities.